Hi, I'm Wendy Murdoch, and this is Webinars with Wendy. I've been doing a series of webinars during the pandemic, largely for my own entertainment, so that I can get to talk to people that I never get the chance to talk to because I'm too busy traveling. So this has been just an amazing thing that's happened doing these webinars, and I had no idea how many I was going to do. This is number 71. I will be taking a little bit of a break in July because I'm traveling to New Hampshire to do a Surefoot workshop and a riding clinic. We're still, it's going to be a little bit changed because my normal clinic schedule I can't really do. But anyway, I'm going to New Hampshire and I may or may not be able to do webinars while I'm away, but we'll certainly pick it back up when I have a good internet signal. That's always the caveat. Today, my guest is Deb Davies, and I heard of Deb through Ida Hammer. Ida and Deb did a joint workshop together, and Ida was she was floating, ecstatic. So clearly I had to have Deb come on for one of the webinars, especially when Ida told me that she can talk all about proprioception. And this is one of my favorite things because I think Surefoot does so much for proprioception, but you know, it's kind of one of those things that it's kind of fuzzy in your brain. You're not really sure what it is, how it works, how you say it, how you spell proprioception is actually a big one. I've managed to obliterate that word on a number of occasions, but we're going to have Deb clarify everything about proprioception. I'm so excited about this. So thank you, Deb, for doing this webinar. Really appreciate it.
Thank you, Wendy. Thank you so much for having me on, and thank you for hosting all these amazing webinars. You know, not only do you just share your wisdom with your clinics around the world, but doing this has added a whole new dimension for all of us. So just thank you.
It's a blast. I actually have so much fun doing this that it's, and now that I've got sort of the technical side down, I'm thinking about getting a headset because Raquel Butler had this cool headset and her sound was so amazing. But anyway, we might upscale a little. So Deb, tell us a little bit about your background because I don't really know how you got started or where you, you have a bit of an accent. So I'm wondering where you're from.
Yeah, so I'll just really share briefly. I'm from England, and I was born, grew up in England, and I started my equestrian career in England. Like many of us do, just going to Barnes, and I worked at a therapeutic riding facility, and just fell in love with everything about the horse. But particularly, even from then, my main interest was how the horse functioned from inside out. That was and has always been my interest. So you know, just really fast forwarding quickly, I went through Pony Club. I did my British Horse Society examinations. I actually was a representative for Great Britain on the junior 3-day event team. And then I went to Europe to compete and ride and work for a junior rider. So I helped train and worked with lots of amazing trainers out there. And the beautiful thing about that was actually she was in school and I got to ride all her horses and go to her trainers and get all this incredible information. And so then I would ride and then she would just get on a horse at the competition. And, you know, in my 20s, that was just amazing for me. I'm like, oh my gosh, I don't have to pay for all this amazing education. So I actually make a joke that I rode my way around Europe, which was actually quite true. And in the early mid-80s, I actually came over here. I was offered a job to work for Norman Delajoyo, who is an Olympic show jumper rider. And he would come, amazing man. And he would come to Europe and buy horses from Francois Maty, whom I rode with at the time. And so I would often, you know, ride horses for Norman to look at. So anyway, long story short, I came over here to work with him, work for him, train with him. You know, I had amazing experiences for many years with Norman.
Where was he based?
He was based in Bedford, New York.
Well, that's what I thought because I'm from Stamford, Connecticut.
Okay.
You know, and so it's like, wait a second, that's a name from the past. I know that name, and I was like, wasn't he in the, you know, the Bedford area?
Yeah, he was at Coca Farm belonging to Judy Richter.
Oh God, yeah.
Yes, the whole thing. So we traveled.
Okay, now what years were you there?
I was there in 85, 86, 87, 88.
Oh yeah, no, I was long gone. Where was I in the 84 is when the horse flipped on. I was in Kentucky at that point. Yeah.
Okay.
Yep.
So yeah, I had a great experience in traveling the US, and then was actually planning to go back to England because, to be honest, I never wanted to come to America. I wanted to stay in Europe. You know, I never appealed to me. It was just too big and everything was just too big, you know. But then I came, and here I am, 30, half my life later anyway. I never left, essentially, and now I'm a resident and all of that. So this is my home, and I love America. And so anyway, after I left Norman, I actually left Norman because I was ready to go back out on my own and start competing again, and just really following my passion, which was learning about horses from the inside out. So just really quickly, I competed to the upper levels in eventing, and at the same time studied all types of modalities, healing modalities, from craniosacral and quantum energetics, and at the same time kind of branched out to start learning about the emotional body, the emotional mind, body, and spirit of the horse, and did a lot of one-on-one time, like me one with a wild horse herd one, away from anybody for like a month at a time, and I just loved that. And so that really, you know, that really kind of blended together my desire to compete and ride and train, and I had a facility at the time, and to just put that together with how does the horse's mind, body, emotional habitat, how can we combine these two to make a healthy, you know, have a healthy relationship with the horses. So I ended up kind of weaning away from competing. I moved to Kentucky and worked at an alternative training facility as the trainer, and got more and more into wanting to learn about the horse's body and train from that perspective. So competition was no longer my primary focus. It was how to support the horse mind, body, spirit from that perspective, and then what comes from that, you know, be it competition, whatever that is. So I went to osteopathic school in 2009 and trained with, studied under Yannick Vlugen, who's just an amazing teacher with tons of information. I also studied osteopathy in the UK. And to this day, what I do essentially now is I travel the world teaching about the horse from the inside out, from the standpoint of the emotional, the physical, the mental, and combining all of those quantum pieces with our own being, and allowing people to ride and fulfill their dreams and missions with their horses from that perspective. And I'm just so blessed.
Well, it sounds like you've really shaped your world to be exactly what you want.
I am so blessed. I am so blessed. And the thing I love most, Wendy, and I think most of the listeners on can relate to this, I love to learn. The horses are such incredible teachers. And if we just step aside and allow them to inform us, we can just learn so much about what they need. And so I'm just a constant, you know, people say I'm a teacher, but I'm actually a student more than a teacher, I believe.
Well, I think being a good student is what makes us the best teacher.
Yes, yes.
You know, when we're willing to keep asking questions and to keep learning and then sharing the information. So I find that teaching helps really clarify my knowledge.
Yeah.
And I get to see it expressed outward, like, and reflected back to me. And then I go, oh, wait, maybe I don't understand this exactly. Or that wasn't how I meant it. So what is it that I said or did that got that result instead of the one I was looking for? And so it's this sort of reflection of our own knowledge and information when we see it in teaching. And that's one of the things I love about it. And why I started writing was the same reason, because when I started to write, I realized, did I really understand it enough to make it clear to someone who knew nothing?
Absolutely.
Perspective. So, you know, I think that the consummate student is the best teacher.
And even subjects and topics that we have, you know, we have an understanding of, you know, when you really go deep and you, as you say, you start to teach, because what you teach is twice learned, you realize, wow, I need to go back and just clarify or deepen that awareness. And that's the part I love. And that was wonderful. I mean, I'm sad for the whole COVID experience and what people went through, but for me, being home to study and be with my horses, which, you know, they're like my laboratory, you know, they're my experiments as I do my in-hand and riding from different perspectives. I've just really got to, you know, hone in on that. So
absolutely. Yeah. I'm now trimming 3 horses, one that has chronic laminitis, one that hasn't really been done much with, and then my own horse. And I always did my own horse, but now I'm, like working through all of this information that I've been getting from all these webinars and going, okay, how's that working? And what do I need to do next? And, oh, did I think about that? And so fortunately, it's totally fine that I can play with these horses and I have backup if I need help.
Right. Yay for backup.
Yay, yep. So, all right. So you have a presentation for us today?
I do. I thought what we do is, and I feel like I just know this much about proprioception, but I'm going to share everything I do know, or as much as I do know, in a short period of time, kind of clam it together. So I thought what we do is I go through, I made a little PowerPoint because I think that kind of helps with understanding and the visual learners. And so I figured I would put this into like 3 sections. The first section would be to help people understand, what is proprioception. I can't even say it. And and why is it important? Why is it important in the horse world, or to us even? And then the second section, I thought I would do a little bit of what I call nerding with nerves. So I would just introduce some of the sensory nerves that work, that are the proprioceptors that govern proprioception. And it might, for some people, it might be a little too much, but I'm just going to go through that really quickly and just recognize when I do that, it's not about understanding the nerves or their names or any of that, but it's more about having an awareness of the locations of the proprioceptors, because these locations are areas that we influence every day with our horses. And then I'm going to end up with a story on a little horse that is a client of mine, and how essentially some injury and surgery affected her proprioceptive ability, and how the surefoot pads are also helping her come back into balance. So yeah, that's the goal for today, Wendy.
That's cool. And I kind of think of this as proprioception 101, because spoiler alert, I looked ahead at your PowerPoint, and it really helped. It's just this really great basic information that so many of us lack, because the words get thrown around, but if we don't really know what they are and what they mean, it's fuzzy, and so we can't capitalize on its maximum potential. So like I said, I cheated.
You're allowed. Yeah. So the thing that I would say to everybody before I pull the slideshow up is, proprioception is one of those things, almost like the autonomic nervous system, that we don't think about. You don't think about getting up off a chair or getting out of your car and say to yourself, oh, hold on, I have to turn my proprioceptors on. It's autonomic. We don't think about it. We don't think about it when we're riding. We don't think about it when we're asking for a transition or a movement from our horse. And yet it is the impetus for correct movement and function. And so if we have a better understanding of what it is and how it works, we can support our horses, because proprioception can be inhibited by some of the things we do, or injuries and so forth. So I really feel like this might be helpful for us just to have a broader spectrum of thought about this topic. And some people, when do we even really, the only time I would say we even really focus on proprioception is if you're getting up in the middle of the night and it's pitch black and you have to go to the bathroom, or you have to go get water or something. And, you're kind of feeling your way around, aren't you? And your body knows where it is in space and time. You're not usually using your visual cortex at that moment. So that would be a really good example, I think, for people to understand, oh, that's when my proprioception really kicks in and I'm really aware of it. Don't you think?
Oh, absolutely. And it's safe to say, too, that whatever you're talking about with the horse and proprioception is the same for people.
Absolutely.
Like proprioception is across the board in mammals, for sure. And I would assume that reptiles, birds, all living animals must have they have to know where they are in space.
Exactly. Yeah.
So this isn't just a horse thing or a human thing. This is a living, breathing animal thing.
Right. So I'll go ahead and share my screen and see what happens here.
It'll be fine. We did a little test.
Yeah, we did a little check in here. There we go.
Awesome.
I think we're good. So we'll begin, Wendy, by just talking a little bit about what it is. So essentially, to to put it in layman's terms and make it really quickly, it's really where your body is in space and time. And it's really stimuli that is given to the sensory neurons in the body. So the sensory neurons pick up this stimuli that goes to the spinal cord and says, hey, figure out what has to happen in order for me to know where to put my feet. So really, that's what, in a nutshell, is happening. So, you know, what are proprioceptors? And that's a really good question, because we have so many nerves in our body, but proprioceptors are what we call specialized nerves. And these specialized nerves are sensory receptors. So they respond to physiological, neurological stimuli throughout the body, as well as environmental stimuli that travel, you know, around the environment and affect our body as well. And we find them primarily there. What I must say is they are all over the body, and they are so strong and so sensitive and more enhanced in the fascial system. And I'm actually not going into too much depth about the fascial system tonight, but there's a lot of research being done about the proprioceptors that are in our fascial system. But what I'm going to specifically speak to tonight are the joints, the muscle body, where there's a lot of proprioceptors, and that are really related to riding, and the skin, and of course that all relates to those same proprioceptors, our pressure receptors in the feet. So we're going to look at that, and then we're going to obviously look at what how does it work. So again, if you think of it as a feedback loop, it's information that is coming from somewhere. So in this case with proprioception, the information is coming from the peripheral region of the horse. So peripheral means outside. So it's coming from neurons that are responding to outside stimuli. And then those sensory neurons send an input, an electrical input to the spinal cord or the brain, depending on what the neuron is. In the spinal cord and the brain, decisions have to be made based on location, speed that the horse is going at, his posture, his balance, what the task is at hand, and again, the environment. And then after that, a response is sent back out, which is called a motoric response, which is sent back out. And it's broadcast in what we call either a feedback loop or a feed forward loop. And we'll be talking about those as we go on with the slides. So that's essentially, you know, a little basis on what proprioception is. So as I said, we have proprioceptors located all over the body. The ones we are talking about today are located in muscle fibers. And those proprioceptors are called muscle spindles. And we're going to go into details with all of these in just a moment. We have other proprioceptors that are located in the interface of the muscles and tendons. And these are called Golgi tendon organs. In the joint capsules, we have mechanoreceptors, which if you think about it, it's mechanical. So those are mechanical receptors that are informing the joint about its torsion, about its angle, about how far it can actually stretch. And then we have others located in the skin, which we call tactile mechanoreceptors. So
Deb, can I just, okay, like, all right, how do I put this? I always thought proprioceptors were a discrete thing, but now I'm learning that because I know about muscle spindles and Golgi and mechanoreceptors and tactile, but I didn't realize they were all considered proprioceptors.
Mm-hmm.
I thought it was like this separate special organelle that was the proprioceptor. I didn't realize that these were all types of proprioceptors.
Correct. They're types of proprioceptors that give information about where you are. So yes, they are considered types of proprioceptors. And these actually work with something which we'll talk about a little bit later, is called the central program generators, which also help the government of moving. But yeah, as you said, these are all, you know, aspects of proprioceptors. So yeah.
So proprioceptor is a general term, and these are specific receptors that are in the class of proprioceptors.
Exactly. So a proprioceptor is a sensory nerve.
Okay.
And these are specific sensory nerves that are located in different areas of the horse.
Okay. Or person.
Or person, yes. Absolutely. Yeah. And they actually, and what they do, a proprioceptor responds to a chemical or a mechanical change. So any kind, as you'll see, there's a lot of stretch receptors through some of these proprioceptors, as we'll look at in the muscle fibers here.
Yeah, because Raquel Butler on her webinar talked about and showed us pictures of the Golgi apparatus and the muscle.
Yeah.
So, but I mean, this is like, you know, news alert. You never stop learning, right?
I know. It's just mind-boggling. I could just study. I could just be a constant student. But so I'm just going to put this is what I call the proprioceptive map. Again, I'm trying to repeat this in a few different ways so people can kind of just get it in a simplified way before we go too deep. And you know, in this there we go. In this slide, I like to break it down and help people think about it as something simple that we might do. So, you know, most people at some point in their life have been on an airplane. Well, you have to have, you get to the airport and you have to figure out which gate you have to go to. So that's kind of like your sensory receptor, if you will. You're being told, okay, you go to this gate, you take this track, you go to this terminal. So you go to that gate, you get that sensory information, you get that information, and you walk to the gate. And at the gate, you get this information about, okay, your flight is now delayed, or your flight is on time, and here's what's going to happen, and here's the temperature where you're going, and here's all the things you need to know about this outgoing flight. And that it's like the gate where you're waiting for your airplane is essentially where you get information about your next step. And that's very similar to what I would correlate to the information that is in the spinal cord and the brain. It's gathered all this information, and now it's kind of assimilating it all and deciding what happens next, or when that information is going to go out. So then you get this information, and finally some little voice comes on the intercom and says, okay, we are boarding our plane now. So here's your walk to the plane. There's your outgoing stimuli. And you're getting on your plane, and then you have a motoric response, which is a literal motor in an airplane taking you to where you need to go. So if we think of the information that comes in and goes out, instead of think about it as like an afferent nerve is a nerve that brings information in, and an efferent nerve is a nerve that takes information out. We just think about it in terms of, oh, this is my story of going from the terminal to the gate to the airplane and then to my destination. It kind of makes it a little easier, I think, for people to understand. So essentially, again, information comes in from the peripheral receptors, also known as sensory or mechanoreceptors. It's projected along incoming nerve systems, so it's incoming information. It travels to the spinal cord and brain, which is the central nervous system. And then the information is processed and a motor response is initiated. So essentially the motor response is the end result of what your horse is going to do in space and time, or what you are going to do in space and time. The information, as it goes to the spinal cord, there's two pathways. Some information goes directly to the spinal cord immediately. And it has to go immediately, because if you think about the response when a horse is in movement, he needs that response right away. So that information that goes to the spinal cord immediately tells him how to orchestrate the muscle movements and the flexion and extension between his joints to make a smooth transition, or to change gait, or how to readjust his posture to the terrain that he's in. And then there's what we call a free nerve ending, which is the proprioceptor. That's the one that goes directly to the brain first. And the reason that goes to the brain first is that is a pain receptor. So if there's any pain, or there's any discomfort in the horse's body, the brain alerts that nerve that, oh my gosh, there's pain. We cannot allow the horse to take this next step. So most of the receptors go straight to the spinal cord, but just one goes off to the brain, and that is what we call a nociceptor, which is a pain receptor. So why is any of this important? You know, okay, so we know horses need proprioception to know where they are in space and time. But what's the big deal? Well, obviously, other than that, the big deal is proprioception and neurologic input and output is essential for the health and vitality and well-being of our horses. Obviously, our riding horses and the horses we work with have to have different elements of posture and balance than perhaps a horse in the wild that doesn't have to carry us. But the horses in the wild, they have to have their correct posture for the job that they do, for their walking 75 miles a day, for their fright and flight response to their environment. So they have to have their correct posture for their job. But for the riding horses, we have to have additional correction and postural awareness and weight-bearing posture because we are asking them to carry us. And the proprioception aids in all of that, and all of that aids in the proprioception. So there's another feedback loop in our proprioceptive awareness. So if we take, first of all, the beginning element of what we're looking for in every horse before we begin riding and training and so forth to support him, we're looking for a weight-bearing posture. And as we know, that is not something a horse is born with. That is a learned posture that is only, again, necessary when we're wanting to ride them. So in order to have correct posture, that horse must have information about the correct use of his muscles, about how his muscles are working together and firing and orchestrating this conversation in order to have a weight-bearing posture, in order to know where his feet are in time and space so that he can have a balanced posture. So that's one of the first things we recognize, oh gosh, that plays into this very fundamental piece of correct posture. The next thing, of course, that we're asking our horses to have is balance, form, and function. We want to be able to ride our horses or work with them in hand and have them be in balance, both laterally and longitudinally, balance with their gaits and their strides so that he can have rhythm and relaxation. But in order to have that, they have to have correct posture. And in order to have both of those things, they have to have healthy proprioceptive input. So then we want coordinated dynamic agility. We want them to move in time and space. It's not enough for us, many people, to sit and look at them, which is a beautiful thing. And there's nothing wrong with the agility and that feeling of actually having that relationship with your horse and jumping fences and galloping cross country or doing what you want to do. But that is all proprioceptive, and that comes from balance, form, and function. So once again, we're looking at input from the proprioceptors to coordinate the agility. And then if you have a horse that is in correct balance, correct form and function, the coordination of that agility actually aids in his proprioceptive response, which then supports him to be able to carry a rider. I mean, how many times have we seen, I'm sure you've seen this, Wendy, that you see a rider take a horse to a mounting block and, they're inverted, their head's inverted, they're in ventriflexion, they have a hollow back, and they put a foot in the stirrup, and that horse is kind of all out of balance and crooked and goes into complete asymmetry because he's not strong enough to carry a rider. And, we might just think, well, we need to strengthen him. But what we don't realize is he's not only not strong enough to carry his rider and to, have balance within his own gaits, he's also we are now interfering with his proprioceptive response, which sets him up for injury, for, twisting ankles, for tripping, for, all kinds of motion detrimental issues affected to his gait. And then he's not going to be relaxed because he's out of balance. So then he goes into his fright and flight response because he doesn't feel balanced. He doesn't feel safe. And horses have to feel safe in everything that we are doing. So if he doesn't feel safe, we are doing what I call increasing the base activity of the sympathetic nervous system, which is his fright and flight system. So when that is increased in any way, what happens is everything gets hyper. So for example, you get hypertone, hyperreactivity, hypersensitive, hyper emotion. Everything gets hyper, it gets turned up a notch. And really it has to, because if you think about what the body is doing, the body is preparing through dropping cortisol and adrenaline into the system and toning getting contracture in the muscles so the horse can take off. The body's preparing that horse to flee, or freeze, or faint. I mean, but all of those responses are, you know, have the same increased base activity. So we simply get on a rider that's on a horse that's out of balance. He's feeling unsafe because he doesn't feel that he can really move his legs correctly and respond to his own nervous system. And so we've already escalated his nervous system, which means he's going to now contract through his muscular system. He's going to get hypertense. He's going to become more emotional and reactive. And then what tends to happen at that point is the rider gets a little nervous. They dump in their own cortisol and adrenal levels. And so we have this escalation where neither horse or rider feels safe, and neither horse and rider are set up to have any kind of productive learning experience. And so that immediately sends different input to that neurological system and affects the proprioceptive signals coming back. So I know this sounds kind of, I hope it doesn't sound confusing because it's really simple, but I'm trying to get across that it's so important that we develop correct posture, balance, form, and function in our horses, that we have them supported in a way that they can do the very thing that we are asking them to do. Otherwise, this whole system can go pretty haywire. So,
and it's that, and I mean, it's the same term I use, the weight-bearing posture. There's a huge difference between a horse just, you know, grazing and wandering around and in the posture to bear weight. And it's that back that is raised, is lifted, is in flexion, that's strong like a bridge, and the back that is hollow. I just think of it as extension as opposed to ventriflexion, but a hollow back is not strong, and you're loading into the legs and into the joints and causing a lot of problems.
Absolutely, absolutely. And then sometimes, unfortunately, you know, the worst thing that a person can do then is add gadgets to try and fix the problem, you know, then, you know, throwing the horse even more so out of balance. And so, you know, so many times we see riders looking for an outcome versus being present with what is and asking the horse one question at a time so it can respond in the way that it can respond in that moment. Yes, I'm in balance, I'm able to do this, or no, I'm not in balance, I need some support. But if we can stay really present and, you know, just educate ourselves a little bit with the whys as to, you know, how and why the horse might be responding the way he is, we don't have to go into pushing him further and further out of his balance and further into essentially increased space activity and fright and flight mode. So yeah, that
I don't know if it's appropriate to ask this question right now, but there's a question about how the vestibular system interacts with the proprioceptive system.
Well, the vestibular system interacts, you know, 100% with the proprioceptive system, because when you're looking at your vestibular system is also related to your hyoid apparatus, your TMJ, your atlas occipital area, which is the whole orientation of your equilibrium. And of course, that relates to the sacrum and the pelvis. So when a horse's vestibular system is out of balance, and it's usually because they have some imbalance either that's coming from the foot itself or is specifically coming from a localized area of the AO junction, the atlas and the occiput, perhaps some of your suboccipital muscles, your TMJ, your hyoid bone. When that system is out of balance, that is part of your proprioceptive system. So that is specifically, and I'm going to talk a little bit about that later, but that will specifically affect your horse's neurologic function. So many horses, and I don't want to get too far off here because we'll get to that, but what I do want to say is it absolutely affects the equilibrium. It affects how they present themselves. Many horses that have vestibular issues look like they may have neurologic issues, and I'll talk about why that is so just a little bit later, if that's okay.
And let me just say, Linda, if you watch Jillian Kreinring's webinar on the hyoid bone, she's done a really excellent presentation, and you get to see how close the inner ear is to this whole TMJ hyoid mechanism. The discussion tonight is not about how to develop weight-bearing posture. I suggest that you go and watch Dr. Raquel Butler's webinar that we did earlier this week. She talks about stretching and strength. This is really a what is it talk tonight, as opposed to how to solve it.
Yeah, absolutely. And that would be a whole week long webinar, right? Okay. So what we're going to do now is we are going to dive in a little bit to what these actually are, you know, the nerves themselves. I call it nerding on nerves. And Ida Hammer, who is just an amazing teacher and so incredibly knowledgeable, she and I get working together, and we nerd for hours, and before we know it, you know, the class is still going, and it's been 13 or 14 hours. So our nerd, and I think there's a lot of people out there that can appreciate that. But we're going to take a look at what these nerves are and how they work, and then we're going to circle back around and see how it relates to the horse, to the horse's movement, I should say. So there's different kinds of mechanoreceptors, or different kinds of proprioceptors, but they all have a very common theme. And that common theme is they transmit information along what we call afferent, which is incoming nerves, to the central nervous system. And I've said that quite a lot, but I will continue to say it again because I think this is really important. Now, tonight, we're really only going to look more at the afferent nerves. We're not going to look at the efferent, the outgoing, but we know that the outgoing nerve response is your motoric response, but we're just not going to look at those pathways. So your sensory mechanoreceptors are responsible for reflexive responses, which specifically is the stretch response. And what they do is they program voluntary responses to stimuli, which means they integrate it with past responses. So the response that comes in now is now being integrated with a past response. And then the spine is saying, do we need to have a reaction based on that previous experience, or do we have what we call a feed-forward response that is going to interpret different information? So there's two systems working here as we are looking at these receptors. So in the slide, you'll see this is what we call an articular mechanoreceptor. And the articular receptors are found in all the joints. And I find that absolutely fascinating, because if you think about how much, I want to say just wear and tear our horses' joints have, and how many influences there are on the horse's joints. And specifically, the first thing that comes to my mind is the foot and the balance of the foot. You know, if you have an imbalanced hoof, or you have a negative plantar or palmar angle in the hoof, or you have a lateral imbalance in the foot, essentially all of the organs, even the joints like right on top of that foot, are going to be primarily affected, but all of the joints that are going further up into the horse's body are going to be strained and torqued. And when we think about that, and we think about the fact that some of your major receptors are in these joints, it's really makes us realize that, my goodness, you know, how many horses do have some interference because of joint issues? And the other thing is, you know, how many times does a horse perhaps get a little kick or a niche in a joint, something localized, maybe a little strain, maybe even just a little filling, a little wind puff, or perhaps his lymphatic system isn't working correctly and he's not able to drain lymph out of that joint. How much strain is actually on that joint now. So there's so many reasons that we want to really be aware of healthy joints in our horses. And this is just, of course, one of them. So in the articular, in the joints, there's 4 main types of receptors. You don't have to worry about the names, but let's just take a look at, you know, what they do. And you're going to see some common themes between all of these. So this first receptor is called a Ruffini receptor. And this is in the very superficial layer of the joint capsule. So that means it's closest to the outside. And this receptor actually responds to stretch. So when we talk about stretch, we mean when we're getting to the outer limits of rotation of the joint, or or when the outer edge of the capsule gets stretched, this is when this nerve will actually respond. So you get a rotation or some form of movement in that capsule. It gets to the capsule gets to the outer edge and hits the outer edge of that joint, and then you get a response from this receptor. So this particular receptor responds to stretch, and it's what we call a low threshold. And what low threshold means is a point must be exceeded in order for that nerve to respond. So it's got to reach a certain point in its stretch in order for this point, this receptor, to actually respond. So that's what we call low threshold. It's also slow adapting, which means as long as the stimuli is applied, so let's say, for example, as long as that stretch is in place, this receptor will respond. But as soon as that stimuli is no longer in place, it stops responding. So what you're going to see throughout these images is different receptors respond to different pieces. So everybody, it's kind of like having a group of people doing a job, and everybody has a different job, and then you all come back together and you kind of share all of the pieces that you've done to create the big picture or to complete the task. So that's what these receptors are doing right here. So it says it works static and dynamic, which means it works when it's in movement and when it's not in movement. So it's working whenever that stretch receptor is activated. So our next receptor is what we call the paciniform. And this is in the deeper layers of the capsule. So here's our first type 1. And now we're going deeper into that joint capsule. And the paciniforms are also found in like fat pads. So every joint has an area of articular fat surrounding it, a fat pad to protect it. So you also find some of these in the fat pads. And of course, across the board, I'm going to say you have receptors through your fascial system. So this one responds to compression, which is the same as the receptors in the foot. Again, this is a low threshold, the same as the other one. And this is dynamic in motion in nature. So this will only work in motion. This receptor kind of is sleeping until motion happens. The third receptor we find in the joint is what we call the Golgi tendon organ, which we're going to talk extensively about when it comes to muscles. And this is in the tendon and the ligament around the joint. So this is right in the middle here. And this responds to active tension. So when there is a stretch, this Golgi tendon organ contracts and gets tensile. And it's the tension in this little receptor or organ, if you will, that creates the motion. It's response to active tension. So it's as soon as there's any kind of activity and there's a tension that happens, so a contraction, any slight contraction, this little tendon will respond to. Now what you'll see here is this is the first high threshold that we have, which means it will respond as soon as there's activity. So when we look at these other two, low threshold, it means that a point has to be reached in order for these to respond. When you have high threshold, it means it's going to respond immediately. So for example, this is going to respond immediately. It notices tension. So that's what high threshold means. It's an immediate response. And slow adapting, again, means it requires quite a lot of stretch for this guy to activate. And he's dynamic in nature. So again, movement. And then the fourth type of receptor we have is what we call the free nerve ending. And I mentioned that earlier on as the nociceptor. And they are pain receptors. So they respond only to pain and inflammation. And you see these receptors, or these nerve endings, I should say, through the fibrous portion of all of the joint capsules. So this is the guy, this little free nerve ending, also called a nociceptor, that if you sprain your ankle or the horse sprains his ankle, this is the little guy that immediately with his high threshold sends a signal to the brain saying, oh my gosh, pain. You send a pain signal to that area, stop this horse moving, stop stop any further activity of that joint. Let's contract the muscles. Let's inflame the tissue. Let's just protect this area. So that's what we mean by high threshold. When it says does not adapt, it means it does not adapt to anything new. It only responds to the same stimuli every single time. So this only responds to pain. It doesn't adapt and respond to anything else. So in summary, for this articular, for this joint receptor, what happens is it transmits incoming information about the position of the joint in space and time. And it also adds, is this joint loaded? Is it unloaded? Is there compression in this joint? Is there pain? And these receptors respond to rotation, they respond to torsion in the joint capsule, and they respond to just general range of motion capacity in a normal gait, walk, trot, canter, gallop, jump. So that's a little bit on the receptors that we find in our joints.
We have one question, I think it's appropriate here.
Yeah.
Are the 4 types of receptors in every joint, or is it dependent on the type of joint?
Almost every joint. And they're not in every joint, but most joints carry these receptors.
Well, and the interesting thing is that from Bob's work, Bob Belker's work,
Yeah.
there's Ruffini and I call them Pacinian receptors in the foot, which is not necessarily related to a joint, because the Ruffini are along just under the sole and the Pacinian are in the heel bulb. So
correct. So these receptors, as I said earlier, these receptors you find in many areas of the foot. You'll find some similar receptors of this in the skin. We find them in the foot. We find them in organs, in the visceral system as well. And we find them in muscles. So these receptors don't just show up in the joints. They're a commonality. Thank you for adding that, Wendy. Yes, absolutely. They're a commonality in the body. So you'll find a Paciniform in the foot that's the receptor in the foot that responds to the compression. Right. The Ruffini receptor in the foot responds to stretch. So yes, thank you for adding that, because they are all over. Those same receptors are all over.
And so if you want to know more about that in the foot, just go watch Robert Belker's 2 webinars. We are going to have him back for a third. He's still, the power failure that he had from the storm was really huge and knocked out a lot of stuff. So we'll get him back.
Yeah, absolutely. No, he's amazing and such a wealth of information. So yeah, shall I go on, Wendy? Any more questions? Are we good with that?
Can one of the receptors have memory because muscles have memory? Well, that's an interesting statement in itself. Do you want to handle that one?
So say it again, please.
Hang on. Basically, the person is questioning whether the nerves have memory because muscles have memory, but I would take into question whether or not muscles actually have memory.
Yeah. So some of the muscle itself doesn't have the memory. It's the receptors that carry the memory, and that's where your feedback and your feed forward loops come in. So the receptors themselves don't have a memory, but the information gets sent to the spinal cord, and the feed forward nerves are the ones that can carry the information and the memory about what happens in space and time. So if you have a like, let's say a free nerve ending that does not adapt, that will never have memory. It's just going to react and respond to pain and the threshold of inflammation and pain. So that is not going to carry memory. But none of these actually have memory, because they're actually primary functionality is to respond or react to what is in space and time at that moment. Does that make sense?
Yes. And if anybody wants to understand more about the concept of pain and memory, I would highly recommend David Butler's work. He's in Sydney, Australia at a university, and it's NOI Group, N-O-I Group. I think it's .com, might be .org, NOI Group, NOI for nociceptor. And he works with people with chronic pain, does a lot of research. He's got some great books. One is called Explain Pain. And he goes through, basically they're working with people with chronic pain and how they can overcome chronic pain. And the bottom line is the memory's in your mind. It's in your head. Sorry, it's in your brain. It's not in the muscle.
Correct.
And that would be true for the horse as well, that these are simply receptors that are sending information. They're the messengers. They're not the message.
Correct. Absolutely. Absolutely. And yeah. And I'll mention something else on that in a little bit later on the slide, but yeah, thank you for that, Wendy. That's a really great question. So the next receptors we're going to look at are the receptors of the skin. And these, just like I said, all of these receptors work together. The skin ones work with the joint ones, work with the feet ones, work with the organs. So they all work together. And I'm just choosing, I've kind of taken a block of 4 that are no more important than the others, but are really related to our writing. So the skin receptors, they're such an interesting, they're so interesting to me because they have all the same stimuli, but it's also extraordinarily different and gives, even these same receptors give different information out. So if we look at the first receptor that we're going to check in with today, that's what we call the Meissner corpuscle. And this is located in the skin of your horse. So right in the skin, in the derma body. And this responds to touch. Now, that's the receptor that if you put your finger on your horse, or your horse, flinches if you touch him, that's the receptor that is giving information back about that touch stimuli. Now, these receptors have what you call a low threshold, which means the longer there's pressure on that skin, the more the nerve adapts. So if you've ever put your finger on a horse or touched a horse and he has an immediate response, his skin kind of twitches a little bit, and you keep that hand there very gently, what you'll notice is it just settles down. It adapts to that sensation. So that sensory nerve no longer has to have that reaction. So that corpuscle adapts to, is fast adapting. So it responds immediately, and it's dynamic in nature, which means it requires a little bit more movement in order for it to be stimulated. So you might, you don't just see your horse's skin quivering without there being some input. You have to touch it, you see a fly touch it, whatever that is. So it's fast adapting when there's a response. So then you have another corpuscle, which is called the Pacinian corpuscle. This is located in the subcutaneous tissue, which is pretty close to the surface of the skin. If you've ever given a subcutaneous little injection, you just have to go underneath that skin derma body. And it's also located in the interosseous membranes. And what those are they're really thick, dense, fibrous sheets of fascia that span space between 2 bones. So if you've got a couple of bones, right, sitting next to each other, they're spans of fascia, the interosseous membranes, the spans of fascia that are between them. And you have a lot of Pacinian corpuscles, proprioceptors in that fascia. These are also in the organs. And I mentioned earlier that you have lots of proprioceptors in your viscera. So these are some of them that actually are in the body of the organs. So these little guys, these respond to deep pressure and vibration. So, if you're actually massaging or you've got any kind of vibrational device on your horse, that's what you're going to see actually respond. And these are, again, low threshold, they're slow adapting, they're dynamic. And you can actually see there's a pattern with many of these. You get a few that are low threshold, some that are high, some that are slow adapting, some that are, faster adapting. So they all have to support one another with their function.
So just to reiterate, the difference between a fast adapting and a slow adapting.
Okay, so the fast adapting is immediately, it responds to whatever the stimuli is. Slow adapting is it means you have to kind of exceed a level. So for example, if you take a joint, okay, a fast adapting would be as soon as there is a response, stimuli, that response in that joint, that nerve adapts immediately. if it's a fast adapting nerve. If it's a slow adapting, it's kind of, oh, it's sleeping by the pool, having a beer, whatever. And it's waiting for that joint to stretch and exceed a certain point, at which time the nerves wake up and say, hey guys, we got to go do something here.
Okay.
But that's a little slow. It's a little slower to wake up. So that's what that means. Yeah. Which incidentally is why I know a lot of my students love this. Is I do a lot of work with what we call the side of ease, side of barrier. So, you know, when you're working with the side of ease on a horse, it's a side where it's easier for that horse to reach a particular position, where he can have his lateral flexion might be easier in that position, or he has more yield. Perhaps on the other direction, it's a little bit more difficult for what could be many, many reasons. But in order to support the horse, if you take him to the side of ease first, where his body doesn't have to react to any additional stimuli or any pain receptors, the body can just kind of go into this parasympathetic response of, oh yeah, this is okay, I can move my head in this direction, my muscles feel like they can stretch and adapt correctly, everything feels good, I'm balanced and I feel safe. So what happens then is all of the nerves that were kind of on guard, waiting for the body to go in the other direction where it didn't feel so safe, they're all just now taking a nap, because they're not being induced. They don't have to adapt to any other stimuli. So if you hold the body for 30 seconds in the side of ease, and then you very slowly take that joint, take that articular surface, maybe just take the head over into a lateral flexion in the other direction that was originally blocked, what you'll find is the horse has more range of motion in that direction, because the stimuli are not present at that moment, because you've gone to a side of ease. So that's a really wonderful exercise to use. And I really do believe fully that, you know, how we teach Wendy that, you know, you'll want to warm your horse up or ride him in the side that's a little bit more comfortable to him first. If it's easier to go right or canter right, pick up your right lead canter first. That's going along those same principles of, you know, letting the stimuli adapt to what feels safe, and then you just going into the side of barrier where you don't have that immediate reaction of those pain receptors or those other deep pressure receptors that are saying, oh my gosh, something doesn't feel safe here. And by the time you've actually taken the body to the direction where perhaps it was a little stuck or immobile or tight before, if you've done your side of ease, side of barrier work, and you've stayed in your side of ease for 30 seconds, you can usually take that say let's just say the AO joint, and ask him to just move his head to the opposite side, which was originally a little uncomfortable, and you won't have that same response, and that actually breaks that cycle. So you're doing a lot of neurological repatterning. So
It's a classic Feldenkrais technique.
Yeah, okay, yeah, totally.
Yeah, Dr. Feldenkrais always would go to the easy side and make the easy side even easier before he went to the side that was difficult.
That's awesome. Yes, awesome. So anyway, going through these are relatively straightforward, as far as we got lots of stretch responses here. We got responders to touch and pressure. We've got a lot of low threshold here, which means, again, the longer you touch or keep the pressure on the skin, the more the nerve will adapt. So we've got one high threshold here, which means as soon as you touch it, it's going to respond. But as you'll see as a theme for the free nerve endings, anything that is a free nerve ending that responds to pain is actually going to respond immediately, obviously for safety reasons.
So we have a question, but I think I'm going to ask it in a more general way. If you're doing any kind of a therapy or treatment, whether that's massage, whether that's using equipment, you are affecting all of these receptors, right?
Absolutely. Yes, absolutely.
And so that's the beauty of doing body work.
Absolutely it is. And not only just body work, but groundwork and in-hand work, mm-hmm. You know, because if we think about the old traditional classical ways, and, you know, I come from the place of, I've done a lot of things wrong with horses and ridden incorrectly without knowing the damage that I was potentially doing, you know, when I was in my 20s and 30s, and I just didn't know. And I was riding with trainers that they meant well, but you know, a lot of this knowledge isn't shared. And I think that's what's so exciting about our industry now, is we're really getting to share more information so that we can really support our horses with form and function and their motion patterns.
Well, and we're finally crossed the barrier where we recognize that we are also an animal, and that the systems that we have, horses also have. There are some variations on that theme, like the hoof is a very specialized structure, but muscles are muscles and nerves are nerves, and a spinal cord and a brain and bones. And so as we're finally recognizing that we can take the knowledge and information that we've had for a long time in the human world and apply it, and therefore apply it to our training.
Yes, absolutely, Wendy. And so having said that, I mean, talking about Feldenkrais, you know, doing body work on our horse, but then being able to implement those teachings of what we've learned about the human body and presenting that to the horse for groundwork, and then transitioning into in-hand work to support that system in a completely different way. I mean, I feel like that is fundamental in the work that we're all doing today. Because gone are the days when people are getting on horses and warming them up in traditional ways. I mean, we need to do that more on the ground to support these muscles, to support the proprioceptors and the sensory nerves, so that we're not actually creating contraction and sympathetic responses before we even get on the horse, because perhaps the horse already has a little asymmetry or tension pattern through a particular muscle or an atrophy. So if you're doing groundwork or in-hand work, I mean, of course, as well as body work, but I'm just adding and taking it to a different level, you're already assimilating some different input into that body before you get on that horse. And I just think it's really wonderful that we're moving in that direction.
Mm-hmm.
So within, we're looking at the muscle receptor stretch reflex right now. And this is what we call the muscle spindle and the Golgi tendon organ, which actually sit inside a muscle. So within every muscle, there are two receptors. This is a receptor, the muscle spindle, and this is your other receptor, the GTO, the Golgi tendon organ. Now, inside the muscle spindle, there's two fibers. There's like an intrafusal and an extrafusal. And this complex system, which is quite complex, actually deals with the change in length and the rate of length of the muscle. So for example, how much stretch there is in that muscle and the time it actually takes for that muscle to stretch that much. So that essentially is the job of the muscle spindle. And then this is, of course, really important for body position and joint position and determining the horse's body's response, or the human body response, to putting itself in a correct position in order to deal with something, a terrain or something else. So we'll look a little bit about how this complex system works. And it is a complex system, but to explain it, I'm going to keep it really, really quite simple. The first thing is,
can I interrupt you for 1 sec? Your microphone is really, I think, close to your touchpad.
Okay.
So sometimes just we get a lot of static when and your volume changes, and I'm not sure why your volume changes.
Okay.
And I'm just pointing it out because I keep adjusting the volume, but I'm not sure how that's happening.
Okay. I don't either. So
okay.
Yeah. Not sure what to do about that, but
no, it sounds like you have a piece of paper near your mic.
Oh, actually, I do have a few notes right here just to keep me.
Maybe just move them away from the computer itself, because that's what it sounds like. It sounds like something rubbing on the mic.
Gotcha. Okay.
Awesome.
Hopefully that would be better. Yeah. I tend to go off track, so I'm like, okay, stay off track.
Yeah, no, it's great. It's just, I just couldn't figure out what was going on, but if the papers are near the mic, that would explain everything.
Okay, very good. All right, thank you.
Yep.
All right. So what we're gonna just.
Sorry, I off tracked you. We're on Golgi tendon organs.
No, you're fine. Well, before I talk about the Golgi tendon organ, what I want you to think about right now is either your horse or a horse you have. And
this particular system that I'm going to talk about is present in every muscle in the horse's body. How many of our horses are asymmetrical? All of them. There's not a symmetrical horse out there. I mean, there just isn't. It's not possible. But does your particular horse have an area where he might be more restricted than other areas? Does he have an area perhaps over his back, over his loins, where he's not fully able to stretch through that dorsal muscular ligament system? Is there an area perhaps in his neck where perhaps he's able to give you more of a flexion or a side bend left and not so much right? The reason I'm asking you to think about this right now is this system, because it's all in all of the organ, all in the muscles, anytime you've got a muscle that cannot stretch, contract, and relax the way it should, you're affecting the proprioceptors in that particular muscle. So I just want us to just kind of have that in the back of our head as I'm going through this, because I think it just makes you think perhaps about some motion capabilities or lack of ability that perhaps your horse has in doing certain exercises or movements that you're asking him to do. So here we have basically the muscle. I've drawn a muscle here. Now, essentially, this whole system is just working with one muscle, but I've drawn two other muscles because I don't want to overload and make it look so super messy. So every time I go from one segment of the muscle to the section of the spinal cord and then back out, essentially it's all going to this same muscle. So this action is happening in one muscle. So how does the system work? Well, first of all, what happens is there is a stretch, and it's usually a quick stretch. And that stretch activates the muscle spindle, which sits inside the muscle. So anytime there is a quick stretch, there's an activation of the spindle, which sends an impulse to a segment of the spinal cord. So here's your spinal cord. So once that impulse, that incoming impulse to the spinal cord reaches the spinal cord then has to figure out, what do I do with this information? Well, because it's a muscle, the impulse is processed and the spinal cord returns the impulse back to the muscle to say, oh, we need to give you a concentric contraction. This is how muscles contract and relax. So an impulse then goes back out from the spinal cord to that same muscle and contracts the muscle. When that same muscle contracts, what that does is it creates tension in what we call this little Golgi tendon organ, which is an inhibitory receptor. So anytime you get a stretch in any muscle, you create tension in the Golgi tendon organ. So here is our muscle now contracted. And here is our contraction, a tension in the Golgi tendon organ. So the Golgi tendon organ then sends an impulse back to the spinal cord saying, okay, I am tense, the muscle's contracted. And then what happens is that response goes to the spinal cord. It does what it needs to do with that impulse and sends the nerve back to that same exact muscle and relaxes it. And ultimately, that is a cycle of contraction and relaxation in a muscle. So it's reasonably straightforward. The Golgi tendon organ, as I say, is inhibitory, whereas the actual muscle spindle itself is excitatory. So an excitatory response is going to be, oh my gosh, we're going to contract. And the other one, the inhibitory response is, oh my gosh, we have to shut everything down. We have to change this and bring it back to the relaxation. So that is the cycle of the muscle spindle and the Golgi tendon organ. Now, this is a very important proprioceptive stimuli, if you will, because it is a loop system that immediately gives information to the spine and tells the spine where this muscle is in time and space relative to the movement, the terrain, and the posture of the horse, and what that muscle has to do in order to stay safe, to support the structures around it, to connect with the ligaments and tendons, and keep this body functioning up on four legs, moving, standing, dealing with, the terrain, however it is, responding and reacting to a a hole in the ground. That's why horses can like just see a hole and immediately move, and you're already in the hole yourself. So this is the system that actually is incredibly important to us as riders, because how many times when we're riding do we create, or do we have contraction patterns in our horses' bodies, or do we have what we call reversed insertion and origin patterns in the muscle complex? What do I mean by that? Muscles have primary jobs. So let's just take a general overall look at the dorsal and the ventral muscles of your horse's body. So if we think about the dorsal muscle system, which is the muscle system above the spinal vertebrae, and that system is a passive system in that it needs to be in relaxation in order for locomotion to happen. It works in hand with your ventral system, which is the system that runs underneath your horse's torso, underneath the spinal vertebrae. And that system is your postural system. So that is saying, hey, we need to engage all of these core muscles to be able to support the posture of this horse. Now, these two work together. Now, if you think about these two working together, you're going to have contraction in the ventral muscles, and you're going to have extension and passivity in the dorsal muscles, which means different impulses are going back and forth from the spinal cord at different moments in time. Now, if you have a horse that doesn't have correct posture, whether he's ridden incorrectly, whether he's been injured and hasn't been rehabbed correctly, whether he's so asymmetrical and in such compensation patterns that it is not possible for his muscular system at this point to regenerate those correct muscles, whatever the reason, if you have a horse that is not using his muscular system correctly, this feedback loop is going to be inhibited. And so he is not going to be so quote unquote quick on his feet. He's not going to be able to respond as quickly to stimuli that are presented within his environment, underneath his feet. He may show signs of perhaps imbalance in his body. He may even show neurologic signs. But when the system can be easily compromised because of compression, asymmetry, atrophy, and injuries, absolutely, and muscle issues.
So out of curiosity, how fast does the nerve impulse travel from the muscle spindle to the central nervous system and back?
It's a good question, Wendy. I cannot tell you the exact how many microseconds that is. It's literally microseconds, because this all happens in the flash. Right. It's interesting to think about it, isn't it? And that's such a good point to bring up, Wendy, because that's why if we've got some pathology, or we've got some inhibitory responses through our mechanical or biomechanical system, that response is going to be inhibited. So that microsecond is no longer a microsecond, and the information maybe isn't going to reach the pathway that it should, or all kinds of variants. But yeah, I don't know the exact. That's a really good question. I need to look that up.
Yeah, well, and that's the thing, is that we're talking about this sort of in what would be lifetimes for the nervous system.
Yeah, absolutely. Yeah, and literally, we think this happens every moment. I mean, every single moment, this is happening. It's not just
about the unbelievable timing that a horse has coming down to a 5-star jump, right, on a cross-country course at speed, and that this all has to work perfectly to make sure that the horse clears the jump with the rider, lands correctly, and gallops on. You start to recognize how exquisite this is, how that's the only word I can think of. Whether it's a person watching, like on Facebook, sometimes there's a dancer or an art performance, and you watch these people, or Cirque du Soleil. I love to go see Cirque du Soleil, and then you realize that this is happening at the speed of light, probably, and I don't even know, but so fast that what we see is an elegant performance, because it's all coordinated.
Absolutely. And that's that is such a great point, because remember we said at the very beginning is, we don't think about these things. We just think what tends to happen is we think about the outcome, what we're going out to do, what we want from our horse, the dressage or the jump or whatever it is. We don't think about all, as you said, the finely orchestrated elements of the entire nervous system, the musculoskeletal system, the mechanical, the emotional system, what the brain's doing through all this, it's just unbelievable to me. It's a lifelong journey of learning and maybe just understanding the little bit that I can. But yeah, when you think about it, it's exquisite. And that's why bringing this type of topic to people's attention is really important, because we don't think about it. And yet this is something that happens every single millisecond of your horse's, and your interaction with your horse. So basically, what happens with all of this information is it is organized. The body takes all of this information from the joints, the skin, the muscles, the tendons, the fascia, the feet, and all of it is analyzed and looked at within the variables of what all the nerves do. So, some of them look at stretch, some of look at temperature, pain, body position, and movement. And then what happens is it takes all this information, it looks at the task at hand, it looks at the environment, it looks at how fast this horse is moving, or, posturally where he is in that absolute moment. And it determines the most appropriate response for that task at hand. And again, milliseconds. And it then determines, how do we respond with a motoric response. So an outgoing response that is now a motor response that is going to orchestrate the movement of the horse's body in time and space. So this information gets organized in relationship to what we call a feedback or a feed forward system. So these are the two systems that are primarily used for movement and proprioceptive information. So the feedback system uses previous experiences to determine how to respond. So these previous experiences are also related to something called the central programming generators. And this is, I'm going to talk a little bit about the CPGs in a second, so I'm going to put that aside. But when we talk about a feedback loop and previous experiences, there's pathways that are formulated from the time a horse gets up on his feet that begin to create neuro responses about movement. So a foal gets up and he moves around and he walks and he learns to move with his mama and he runs. And all of the time, this feedback from his movement patterns is being recorded through this feedback system and through nerves called central program generators. So that is one way that information, proprioceptive information, comes out in a motoric form to inform the body what to do. And then the other way is what we call a feed forward system. And that's a system that doesn't kind of kick into place until after the task has happened. So for example, the horse might pick up his foot to begin the first aspect of that stance, of that gait. And what happens then is the body adapts, or the nerves adapt, and the information is adapted while the horse is in motion, altering any kind of movement or activation based on constant sensory feedback that it's getting from the system. So you have two systems at play here. You've got a feedback that's moving, creating movement based on previous experiences, and a feed forward that is responding to the movement in time and space as it's happening and as it's taking in new information from the stimuli in the present moment. So these are the two systems that are essentially
So as an example, it would be like, I learned how to ride a bike, so I know how to ride a bike. So my feedback is that I know how to ride a bike. Correct. But I haven't ridden a bike in a long time, and I get on one that's different than what I learned on. And now I have to be in real time sorting out, wait, I have more gears, my brakes in a different place, my handlebars steer a little differently. So that's my feed forward. It's like, I know how to do this, but I don't know how to do this one.
Yeah, that's a really great example of it. And another one to add to your analogy of it is, you know, you rode a bike, and maybe you went out on your bike today, but tomorrow you go out on your bike and you are actually you're going over different terrain and there's a pothole. And so your feed forward stimuli is like, oh, we have to respond to that pothole. Or you know, maybe your foot falls off the stirrup of your bike, and now you've got to like, oh, I got to rebalance and readapt and keep myself in time and space. So all of those things. So yeah, the external as well as the internal. Yeah, absolutely.
Got it.
Okay, so we're coming towards the end. I don't have a clue what time it is. Oh my gosh.
Don't worry about it. Just keep going. Don't look at the clock.
Okay, fine. All right. So we have some areas of the horse that are more highly sensitive. So we call them highly sensitive proprioceptive areas. So more sensitive than perhaps the others. And just want to, you know, mention a couple of these to you. So one of them is the cervical spine. And the cervical spine has mechanoreceptors not only in the deep flexor and extensor muscles of the neck, but it also has it in the facet joints, which are the joints which help each of the cervical vertebrae articulate together. So in each of the articulations of that cervical vertebrae are mechanoreceptors. So that's that's such an intricate system that's actually giving us information about where each of these segments of the spine and the vertebrae are in space and time as well, which is why it is so incredibly detrimental to a horse and to his nervous system to force a head in a position, whether it's with your hands, or whether it's with a device, whether it's with any kind of martingale or gadget, because you can actually really damage these receptors by compressing these vertebrae. So that's not a good thing to do. The other thing that I'm actually going to talk about with the neck is a very interesting an interesting topic, and this was actually, I read about this from a veterinarian in Great Britain, and this is the effect of a mimic of neurologic symptoms in a horse that really are not truly neurologic because of asymmetry in his neck and in the muscles of his neck, particularly the suboccipital muscles of the neck. So you notice like an asymmetry or an atrophy in these muscles. So first of all, why would we get asymmetry and atrophy up there? Well, we touched on it a little earlier, because we have, this is a huge balancing mechanism in the horse. And, you know, when a horse is out of balance, there's so many reasons he can be out of balance. First of all, he can be out of balance because his feet are painful or his feet are not in correct balance. And so you've got this whole fascial line, which comes from the ligaments and the capsules of the feet. So this fascial line will then activate other fascial restrictions through the body if the feet are out of balance. And it puts an incredible strain on both the neck and the atlas occipital area, as well as your sacrum and your pelvis, because if the feet are out of balance, the rest of the body, particularly the sacrum and the pelvis, where your parasympathetic system sits, and your brainstem, so you're talking about your atlas occipital region, they are constantly looking to redefine what balance is, what safety is. You find the pelvis, when there's that fascial strain, you can get all kinds of instabilities and destabilizations in the spine, which then can cause compensation patterns through the horse's suboccipital area, because he doesn't know where he is in space and time. So he's contracting in these suboccipital muscles, which then prevent the elasticity and the reflex of relaxation and stretch through the neck. So remember, we said that the proprioceptors are going to respond to stretch in the muscles. If you don't get a stretch in the muscle because you've got a compensation pattern that's causing contraction, then you're not going to get proprioception, or at least you're going to get inhibited proprioception. So this study that this vet did in the UK was actually because he was treating a horse that presented with wobbler syndrome, which is, just in case you don't know, that's when you've got some cervical restriction that's actually potentially putting pressure on the spinal cord itself and causing neurological patterning. And it's very dangerous because, anytime that you have a vertebrae so close to the spine, you could drop, that horse could drop at any point in time. So they went in and they did x-rays of this horse's neck, and they did CAT scans and so forth. And he was very much expecting to find this kind of pathology. And they found absolutely nothing whatsoever. And what he studied and what he looked at was the muscular development of that horse's, basically his suboccipitals, but also going into the splenius muscle. And there was such atrophy through those muscles that it was the atrophy through the muscles that were preventing the stretch receptors from giving off correct proprioceptive information, and therefore not informing the body of where it was in time and space. Now, isn't that unbelievable? I mean, to me, I was just blown away because to me, the neck is just so fascinating, but it made so much sense to me because that is one of the first places where a horse will go into contraction and restriction just to compensate from overall body balance.
And it's the place that we attach to with a halter.
Absolutely.
Yes.
Yes.
I've watched people think nothing of, and to be honest, I've done it myself in the past, slamming on a lead shank and, with a difficult horse. I don't think there's a horse person alive that can say that they've never done that, or if they haven't handled a lot of difficult horses. But, but my point being, this is how we handle a horse. We put something on their head, and then things, just as simple as tying a horse and having it pull back.
Yes, absolutely. And you're right. Without having an understanding or an awareness of what we're doing to that little foal, when we first put that halter on his head, right then, when he pulls back and you pull, and then, yeah, we've all done it. And with riding, I mean, I hate to think how many times in my past I have pulled on a horse's mouth because I didn't know any better. I certainly don't do that anymore. And we're seeking longitudinal flexion and extension and reciprocation and lightness, but not everybody still out in the world is riding that way. And it just is, to see the devices that are put on these horses, it just breaks my heart, because below the surface what's actually happening. You have an understanding and appreciation of the systems you're affecting. And then, these horses get labeled as bad horses because they're having pain and discomfort. They don't feel safe. Their sympathetic system is increased. They don't know where they are in time and space. So let's tie their head down to help him find where he is in time. It's just such a destructive cycle that we see. But the neck is really so important. And
it's really interesting. I had a guest on actually very early on. His name is Sean Patrick, and he's a yeah. And so I was teaching down at Sean's place, and I gave him a Feldenkrais lesson, and the lesson I gave him, at the end, I had him on all fours, and I was working through his spine from his head, and I was just in my Feldenkrais mode and wasn't, I was just going along and doing what I do. But afterward, his comment was so profound that I've never forgotten it. And I'm not going to get the words exact, but the meaning was that I had a hold of his head, and what that felt like to have someone have control of his head changed how he viewed how he controls a horse's head. If you just imagine somebody come up and putting a halter and pulling your head around, and then we think nothing of doing that with a horse because it's a big, strong animal. But if there is a weakness in there, if there is a lack of development, if there is an imbalance, then, what kind of additional damage are we doing unconsciously and with many names on it? Okay. And that's the thing, with many names on it, with many disciplines. And I'm not trying to lay blame on anyone, because I've been there and I've done it too. All right. And I'm the first one to say that I can't cast any stones. But the thing is, what we have to do is learn from our experiences and understand that we want to choose to do it differently now.
Absolutely. Absolutely, totally. And I think just again, you know, when you start educating yourself, when we all learn more and we understand the connections and the influence we are having on these horses, then we can make different choices. So, you know, knowledge is essential to being the best that we can be for our horses, and just, you know, simple understandings like you said earlier, Jillian Crimebrings, she's a great friend and colleague of mine, and her lecture on understanding the hyoid and the effects of the hyoid and the TMJ on the equilibrium and the balance, the proprioceptive system and your vestibular system. And the thing is, when you touch a horse's head, you are influencing a multitude of nerve endings, which go all the way through his spine to his hindquarters. I mean, you can, if you lightly ask a horse for a lateral flexion, you can actually see that lateral flexion going all the way through the spine to his sacrum area. You know, that's where side bend, that's where bend begins. Or I shouldn't say that's where it begins, because it begins in the middle, but you have but you have to facilitate a lateral flexion to be able to release the balance and the equilibrium system in order for the horse to actually find the middle to release and find a balance. So it's understanding some of these things and recognizing, like, you know, your occiput is a mirror to what's going in the hindquarters. So if you have a restriction up here, whether it's a muscular restriction, which eventually causes perhaps immobility at the atlas or occiput, or any of those C1, C2 through C3 junction joints, you are going to have the exact same dysfunction happening in the hindquarters because they're mirrors. Understanding of the effect of how you have a connection between the atlas, occiput, your TMJ, your hyoid, all the way down to your sternum, and then all the way through what we call the linea alba fascia to the pubic bone. So now you have a knowledge that, wait, my hyoid bone and my TMJ and my atlas is attached to my pubic bone, and I'm a quadruped, and I'm in this asymmetrical pattern. You just have to think about the mechanical strain, the muscular strain of the body, as well as the fascial strain that's happening throughout that body, reversing, as we said earlier, perhaps contraction where they should be relaxation, and just reversing muscle insertion points, and completely changing the horse's equilibrium, changing his proprioception. And then we go in and we say, well, he did it yesterday, or he did it last week, he's just not behaving himself, or he doesn't want to do it today. And a horse does not have the capacity to do that from an emotional standpoint. Their neocortex cannot he doesn't have a neocortex. I mean, he has, I think it's like a millimeter of compared to us, he has none.
Yes, but enough to do the things that it needs to do.
Yes, absolutely, but not enough to have defense physiology like we do, which is completely.
Well, but I was going to bring up a point that the body will defend itself, and if the body feels threatened, it is going to stiffen and resist to protect. We all do what horses do it. You know, like I'll be working with a student, I'll put my hands on that. So I don't know how I'm going to do that anymore, but you know, I put my hands on a student, I can feel the resistance, and it's like, you know, I need to stop and talk to them for a minute, because their mind is, you know, they're saying, yeah, it's fine, you can do what, you know, move my leg, but their body's saying, I'm not going to allow you to do anything. And that's not on a conscious level, that's on an unconscious level. The body will defend. And so the horse's body will defend itself against some of the things that we do. But the question is, at what cost?
Yeah.
And the cost is inability to perform, inability to move, inability to actually do what we want him to do, because he's too busy defending against what is happening.
Right, and that's exactly right. But the thing I was mentioning is, it's not like a psychological thing like we do. Like, I'm just not going to do that for that person. I don't want to. It's not so much an emotional, you know, psychological response of a storyline. I don't want to do that to her. I want to do it my way. It's more of a neurologic sympathetic response of defense.
Vagus is going to say, I'm not safe.
Yes, exactly. Vagal nerve is going to say, sorry, not safe. Then it goes into its defense mechanism. Their defense mechanism is not an emotional one, because they don't have that thinking brain to actually make up a story to say, hey, you, I don't want to do that I don't want to do that today. I don't want to you know, I think I'm just going to push you around today. They're not intentionally doing that. It's not an intentional thing. That's what I'm saying.
Yeah, I always tell people that, you know, where's my phone? Oh, it's right there. It's because I have Facebook on it. But, you know, I have an iWatch. Like, I watched Star Trek and they had communicate. I watched Dick Tracy and now we have them. I don't see a single horse that's created an iPhone and iWatch. They don't have the capacity to imagine and create in the way that we do. That's what our neocortex does.
Neocortex does, yes.
But at the same time, the downside of our neocortex is we make up these incredible fantasies about why our horse is doing something.
Right, and that's case in point. We make up, we call that in our psychology work is like defense physiology. We make up these stories based on past experiences or things that we've heard or learned that are not real and not true, or we make up a story and relate it to our horse. So as similar as we are in so many ways, we put our storyline on our horse, and that is not his story at all. His body is reacting to his sympathetic response, his vagal response. And it's not like he's saying, screw you and giving you the hoof type of thing. You know, he's not emotionally doing that. So, you know, I feel like I hear a lot of people saying, well, he's just this, he's just that, or, you know, he's not respecting me, or a horse doesn't have the capacity to actually do that. So,
right.
You know,
And that's where, you know, I've had 2 webinars with Dr. Stephen Peters, who's the human neuropsychologist that wrote Evidence-Based Horsemanship. And I highly recommend everybody that has been watching this webinar to go back and watch his webinars, because he specifically addresses these things of what parts of the brain the horse has, what is the function of the parts of the brain the horse has, what, given the parts of the brain, how is this going to play out, and what cannot happen. And what cannot happen is a horse doesn't make a story. Do they have memory? Absolutely. Do they remember situations and people and things that absolutely. Do they have PTSD because of the amygdala? Absolutely. But they're motor-based creatures, and there's just a little bit of frontal lobe for problem solving, for attention. There's even a question about how much sense of self a horse has. There's some research on that, but they're not, they don't have the capacity to dream and create in fantasy environments. We do that and put it on them. Right. And our nervous system responds and reacts to our nervous system because we're already putting out neurochemicals and pheromones that are in our stress response that the horse is then reading, and we think he's reading, you know, doing this because, but he's actually picking up on us.
Absolutely, exactly. And that's when you see that motoric sympathetic response, that fright and flight response. So yes, totally. So yeah, it's just really interesting. I think that's why we just have to become a little bit more educated about the response versus the reactions that they are giving us, and our responses and our reactions and influences to them. So absolutely.
And just in defense of things that we have done with our horses, because I can already hear people from watching the webinar that are already beating themselves up for what they've done. And that is not a useful thing. There is, again, a story that we're creating, and the horses, you know, we've all been imperfect. That is part of the reality of this environment, this world that we're in, that we are imperfect and we make mistakes. And what I find is that horses are so willing to forgive the mistake as long as they understand that the intention is clear and that the intention really is to do no harm. But when the intention is to harm, the horse is going to react in a very different way. And so, you know, we're not perfect. We all make mistakes. I can think of a number of horses that from my childhood, and I'm like, if I had it to do over again, I would do it differently. Well, you know what? I can't do it over again. All I can do is educate myself and make sure I have enough choices so that I don't get in that frustrating bind where abuse happens. And I really believe that abuse happens where we run out of choices and we don't have another option.
Yeah, I absolutely agree. And we can't learn or allow ourselves to relearn if we're stuck in all of the things we did wrong in the past. Because as you said, we've all done it. And we'll do it again, not intentionally. We'll make mistakes again. I mean, won't we? I mean, none of us are perfect.
Oh yeah. I mean, yes, absolutely. We make mistakes again. And we, you know, if we've had old patterns, we tend to fall back. I can think of yesterday, I fell back on an old pattern. And then afterward, I was like, wow, that's an old pattern.
Yeah.
But but the more we recognize it. Okay,
Yeah,
so
absolutely. So anyway, moving on. So the cervical spine obviously has highly sensitive areas. The thoracolumbar fascia is another highly sensitive area, because we have many layers of the fascia that comes from the thorax through the lumbars to the sacral area of the horse. And you've got your Golgi tendon organs that are actually situated in there. So again, this is super important that we have an understanding of the stretch, the extension and the flexion, the stretch function of our horse's top line. Working our horse correctly and posturally correct, and understanding actually what some of the terminology is. Like, you know, we hear all the time, the horse has to be in self-carriage. What actually is self-carriage and how do you get it? And where are the muscles and what are the muscles that are orchestrated in actually achieving that so the horse can perform correctly? When a horse actually stretches correctly through his top line, there's a hormone released, which is an insulin-based hormone. And that hormone actually carries within it the building blocks for the correct muscle fibers, I should say. So it's the correct muscle fibers. So when you have a horse that correctly stretches through his top line, because he's being worked correctly, because his his thoracic lumbar vertebrae and his cervical vertebrae can actually move and articulate the way they're supposed to, these hormones are released, which then helps for the foundational development of the correct fibers of the muscle. So it makes the muscle stronger and healthier. A horse that does not have those correct stretch mechanisms through his body will certainly have a top line, but it won't be healthy, and those muscles will not be healthy. So the importance of stretch is imperative, not only for the health and the well-being of the horse and his postural system, but also for his proprioceptive system.
wow.
Your SI joints have a lot of articular mechanoreceptors, and these receptors in here are constantly having conversations with the hindquarters, with the lower region of the back, and they are receiving lots of information from the feet, where you have your pressure receptors. So the pressure receptors of the feet are sending impulses constantly. As Ida would say, it's the first and the last thing that hits the ground. And any type of fascial restriction coming from the horse's feet is going to create barriers in the communication between the pressure receptors of the foot and the communication as it goes into the spine. So there's going to be a delay in the information getting to the spine. And that's kind of like if you were to wear a high heel shoe, or if you walk around, the bigger the wedge or the height of your shoe, your own personal shoe as a human, the less able the proprioceptors are in your feet are to be able to respond to where you are in time and space, because you've got this false information hindering the information of the proprioceptors. So that's why people have lots of different types of accidents and twist their ankles and all sorts of things when you have high shoes. That's when horses that are shod or have an imbalance in their feet, their posture will lock into that imbalance throughout the body and cause such an asymmetry through the fascia and through the muscles that we start to run into severe compensation and proprioceptive information default. So the body is getting the wrong information. So that might be, for example, if you ask a diagonal pair of legs to move back and forward, just doing some light in-hand work, you find one foot will move, but the other doesn't. That's kind of inhibitory responses to the information coming in primarily from the feet. So lots of information in the feet. So as we wrap up here, in alignment and working with your proprioceptors, we have something called your central programming generators. And I just talked about those very briefly. They work with the proprioceptors, but the biggest difference with these is that a proprioceptor has information coming in and then it has information going out. The CPGs do not have any incoming information. That information is already stored in the brain. So that information just gives output. It doesn't receive input, but it does work with patterns and information that comes in from the proprioceptors, so that the central programming generators might have to modify what they're doing based on the proprioceptive feedback that they're getting. But these central programming generators determine the rhythmical patterns of the flexion and extension in the swing stance of your face. So it's basically, where is that foot in time and space, and how much flexion and extension do we need to coordinate all these limbs working together? And in like neuroanatomy, these CPGs are called neural oscillators, and what they're like is a light switch, and the light switch turns on and arranges the gaits of the horse as the body knows how to arrange them with the proprioceptive feedback. And then what it does is it allows us to fine-tune and work with those gaits ourselves as riders. So we have that capability. I find the very interesting thing that I have learned about the CPGs is they have two major neural areas where they sit, one in the front of the horse, right around the withers where the thoracic ganglions are, and then one towards the back of the horse. And the CPGs in the front of the horse inform the CPGs at the back of the horse. So essentially, what we're doing here, this is kind of revolutionary, because the front legs are talking to the back legs. And throughout time, we are always thinking about engaging the hind end and getting the hind end going first, which absolutely we have to have engagement of the hind end. But in actual fact, these central programming generators are helping us understand that much of that information at the hind end needs to come from the front end first. And you know, this is
really interesting, because several years ago I did a little video where I had two skeletons. I have a horse skeleton and my little Ned, my human skeleton. And I talked about the importance of the withers having to come up in order for the hind end to come underneath.
Yes.
Well, that video was on Facebook, and someone sent it to a dressage trainer named Brian Ford.
Mm-hmm.
And Brian Ford, because of the pandemic, not only watched the video, he went out and experimented with his horses, and he's done a segment on Horse Radio News talking about how it's completely changed his training system, recognizing that the front end has to be organized before the rear end. So he's no longer worrying about engaging the hindquarters.
Yes.
He's worrying about the front end coming up so that the hindquarters will automatically engage.
Absolutely, Wendy. Absolutely. And you know, when you start working with the front end, and with my in-hand work, I actually start a lot with working with the front end of the horse. And of course, you have to, with the organization of that, you have to have the release through the base of the neck and the telescoping, and you have the thoracic sling free. But as you said, then those program generators inform the hind end, and it's providing everything is able and capable to function back there. It's amazing how it changes the horse's, the ability for the horse to move functionally without you having to push and force or do anything. It's not about that. So yeah, it's really interesting. And the central programming generators also, they help with the diagonal information. Now, not just diagonal as in the trot, but in any gait, you're always having the information of the CPGs talk to the, say, for example, the right front, left hind, or the left front, left and right hind. So it's orchestrating information between the diagonal sides, which is of course the right brain working the left side, the left working the right. And so there's all these connections which just fascinate me. And also, if you're ever riding and you feel your horse is a little heavy on your right rein, that is generally your CPG reorganizers, or trying to organize. Or you might find that if he's heavy on the right rein, the other diagonal pair, you don't have quite a response to that him responding to your opposite leg. So you can recognize that your horse has perhaps some imbalances in his body, and his central programming generators are needing you to support him a little bit by freeing up that front end and giving more information. And you will start to find that your horse balances out, and you feel it both under saddle, in hand, through your legs, your seat, and your reins.
So are the central generating program generators actually within the spinal cord?
Actually, no, they sit outside of the spinal cord. They're clusters of nerves, essentially, that sit outside, like the ganglions do. So
Okay.
they're sitting outside of the.
And where along the spine are they, or roughly along, are they located?
So they're roughly located right around the top of the withers, like well, I should say, if you between the base of the neck and where the withers. So where the first thoracic vertebrae starts to come in,
Yep.
around the first, second, third thoracic vertebrae in that particular region there. So right around the withers, and then in the hindquarters, they're located right between the lumbars and the SI joint.
So, I think the timing of this webinar has been so unconsciously brilliant, because yesterday we talked about thoracic spine with the Equisoma folks, Pam and Diane. The day before we talked to Raquel Butler, and she talked about stretching into strength. You've touched on so many subjects that we have webinars that you can go back and watch that add depth to the information. And if there's pieces of this talk, because this is really in depth, and even though it seemed very simple, this is so deep. But there's lots of other webinars that you can go back and look at so that you can put this together in your head, because I'm sitting here listening to this, and I have a master's degree in equine reproductive physiology, so I can follow a lot of what you're talking about. But I know that there's some people in the audience that probably are going, whoa, my head is swimming.
Right.
But the good news is there's lots of other webinars they can go and.
Right. And the thing is too, is that you can, because you put this up online, you can actually go back and look through it again, so that you can start to understand it perhaps in a different time and space. So you're not, really going into, you can do it in your own time. You don't have to follow through. And
so all the webinars, just because somebody's asking where they are, they're all on the Surefoot Equine YouTube channel. So just go to YouTube, put in Surefoot Equine, subscribe to the channel. When we put up new video, you'll get a notice. And that's there. This is number, did I say 70?
71, I think.
71, I've lost track. Okay. So,
all right, so let's just get wrapped up here. So essentially,
okay, I have some questions for you. So let's do the questions really quick while we have a little break. Okay. Someone's asking, out of the 4 proprioceptors mentioned tonight, is there one that dominates the others, or does it depend on the stimuli, such as constant pain to a foot?
Well, if there's a free nerve ending, if there's constant pain, will always be the dominant one, because that goes straight to the brain. So the brain is going to give you that constant input. So pain will always dominate, because that has to protect the body. But other than that, they all work equally. But you have to remember, there's some that work with stretch receptors, some that work with pressure. So if you have, a movement in a joint where there isn't so much pressure, but there's a lot of stretch, that is going to dominate the one versus the pressure one. Do you see what I mean? So it depends on it. They all work equally, but it depends on the function in the moment and the movement in the moment as to whether it's their turn to respond or not.
Right. So they kind of share the work and decide if it's this particular movement, then this one's going to predominate because it's addressing that specific issue.
Correct. Yes.
I just want to make sure we don't miss on the overview the impact of the physiopads. I know you haven't.
Yeah, so I'm just going to skip over.
Let me just do these other 2 questions.
Sure.
Okay. Can you have too many stimuli, such as saddle, breast collar, boots? In other words, too many things making contact.
Yeah. The only way you can't have too many things making contact, but what you can have is if you have ill-fitting equipment that is causing increased base activity because you've got, again, pain, okay? Then you've got all of this pain stimuli throughout the body, which is going to be the dominant stimuli. So, I think I'm a big believer in less is more anyway. But yes, you have to be really, and this brings us into really this topic right here, is we have to be really aware of the equipment that we have on a horse, the correct fitting of it, because let's face it, as soon as you put a saddle or you get on a horse, you are affecting his neurologic, his muscular system, biomechanics, and all that feedback loop, because you're putting pressure. And even if you're the best rider and you've got the best posture, but if you've got an ill-fitting saddle, your posture isn't correct, you're not in a neutral pelvis, you don't have an understanding of the mechanics of your body, then you can cause so much more stimulation, because the horse's body goes into increased base activity. So that would be my answer to that.
Right. And I think a simple way to think about that for women is that if you have a tight bra strap or a bra strap that keeps falling off your shoulder, you're constantly annoyed or dealing with that. Whereas when your clothes fit well, you don't notice them, right? You just go about your business. And
Right.
so when the equipment is fitting well, when it doesn't, it's not so much the quantity, but the fit. You can't ever overcome like walking in stiletto heels versus hiking boots when you're out on the trail, right?
Exactly.
So there was one other thought, but anyway, keep going. I'm gonna just check the chat. We've got some comments there.
So just thinking about our effect on proprioception, just in your mind, and I'm not going to go into details because we are going really late. Think about posture. Think about the actual movement that your horse is offering you, and is it correct movement? Is it balanced? Think about the transitions that the horse is making. Is he able to make transitions, or is he struggling in his transitions? That doesn't mean he's bad, he's naughty, he's any label. It means if he is struggling perhaps in transmissions, it's an opportunity for you to perhaps look and see if there is some inhibition somewhere. We've looked at organ, we've looked at joints, we've looked at skin, we've looked at muscles, we've looked at our own body responses. So, you know, many people like try to force their horses into transitions. And I urge you, if you're having difficulty or your horse is unable to pick up a cantilever, make a transition as smoothly and as balanced as you would like, don't force him. Bring yourself back to perhaps looking at some of the other factors that are playing into his movement patterns. Is he proprioceptively able to orchestrate two diagonal pairs of legs, and is he organizing his front legs and his hind legs? If he's not able to do that, then you're not going to have an adequate smooth transition because your proprioceptive system is inhibited. Look at the changes in
what you can do to change that proprioceptive system.
Yeah, well, that was where I was going with terrain changes. So first of all, terrain changes are the best thing for a horse to start to be more informed about his proprioceptive system. So I have actually in the makings an acre worth of land where I have different footings in throughout this acre. So I'll put sand. I've got sand in one area. We're going to have, crushed rock in another. We're going to have a dip, a dip in the grass. So he has to walk up and downhill. We're going to have water in another area. So we're just having all of these different surfaces. So the horse has to walk on all different surfaces. Now my horses are all bare feet, so that proprioceptive input is immediate as they go from perhaps a solid grass to walking down a dip to walking on some crushed rock to walking in sand. So their body immediately starts to respond to these changes. So introducing proprioceptive awareness by terrain changes is really super. Having, like your little seesaws that you can walk your horse over, so he has to change balance and reorganize himself, walking over bridges and even different sounding devices. So if you have a little wooden bridge that you can walk over and it even sounds different, that is proprioceptive input as well. So anything like that. Again, I'm a great believer in doing in-hand work and having an understanding of how each foot and how each leg can move in and of its own accord and then work together. So taking some time to just perhaps understand, there's amazing trainers out there that do in-hand work. Jillian Cranbring does wonderful in-hand work. You do all kinds of proprioceptive work. Putting the horses on these surefoot pads are just incredible for proprioceptive integration as far as I'm concerned. I don't know the science.
Nobody does.
I don't understand. I have stories.
That's awesome. And actually, you've given us the science because, and this was what I did right in the beginning is I called up Bob Belker. He was the first person I called and asked what's going on. But, when you look at the work that he's done in terms of identifying all of these receptors, which now I realize they're all proprioceptors, even though I thought that was somehow different. Don't worry about it. That's what we're affecting. We're affecting the proprioceptors. We're giving the horse an organization and space that he is either lost or didn't have. And looking at these, what was the CNGs? Not CNGs. The central system organizers.
Oh, the central
generators.
It is, yeah.
Yeah, I know that has to be affected when you watch these horses sway because you see them sway in these crazy patterns.
Yes.
But I think you have a picture.
I do. I have and you guys can look back at some of the proprioceptive damage that we see on the slide when Wendy puts it up. But this is a horse that I started working with in 2016. She was bought sight unseen, and she looked just fabulous on video. But she got off the trailer, and I kind of said to the owner, "Don't ever buy a horse sight unseen." But anyway, this little horse basically came off the trainer's skin and bones. She wasn't anything like she looked in the video, and she was lame. There was, I mean, even 1 or 2 degrees, she was lame. Her body was in tension patterns. She had stresses throughout her body. So anyway, long story short, this was 2016. She had an abscess in 2017. This whole story went on for about 2 years. She would abscess, she would be lame. They had x-rays and they diagnosed her with thin soles. And they did actually see some old pedal osteitis, perhaps old infection. But the owners are just amazing owners. They did everything that the vets said they should do. They put this horse in rocker shoes. You know, at that time they weren't clear about the effects of the barefoot trimming, but at that point they did everything they could to try to make this horse comfortable. So anyway, long story short, after about 2 years, in June, I think it was like June 2019, this horse abscessed again, and she never got sound. The infection didn't clear up. She did not get sound at all. And finally, in August the 17th, they brought in another veterinarian to take x-rays and really look at this horse. And she got diagnosed with a keratitis of her hoof, which I still to this day am not completely sure what I had a keratitis in my eye, and I had to have a cornea transplant. So I know it's a bacterial infection that actually eats through stuff. So in a foot, I'm not sure how that presents. But it was a keratitis, which is essentially a bacterial infection that's working through the bone of her foot and working through the pedal bone and just demineralizing the hoof. So she had surgery in August of, I think it was August, let me just check. It was August last year in 2019. And this little mare was skin and bones. I mean, they did everything they could do to feed her up, and just nothing happened. Her body was just tension. And anyway, she had surgery. They took out they removed the keratitis. They obviously had to resection the entire foot. And literally, Wendy, in 5 days at the University of Madison, she gained 88 pounds because of the stress and the pain relief of her. So for all of those years, this mare was in pain. So you can imagine the effect of the body. If we're talking about nociceptors now, constant input to the brain, pain. So no opportunity then for parasympathetic response. Her proprioceptive system was all over the place. You could see the sweetness of this mare, but she was in pain, and she would show ugly behaviors because she was in pain. But she was the sweetest thing. So part of her rehab has been the physio pads that they have been using on her and for her to restore her proprioceptive ability, to start trusting again that her body can feel differently. And amazingly, the other week I was out there and I just had the rider get on, and she hadn't been on a whole lot, but the horse's body completely changed. We put the physio pads on, and the horse goes over to the physio pads and she stands on them. Now here's the fascinating, this just makes me so excited to share this little piece, but I don't understand it completely. So she has both her feet right on the physio pad, and then she moves the right front foot where she had the surgery and puts the toe on the physio pad right where she had the surgery and right where that foot is starting to grow out again. And she stands with just her toe on this physio pad. And I was just blown away, Wendy. It's like, oh my gosh, she knows, her body knows where she needs to be in time and space to support her. And I was like, I wish I knew what was happening right now in her brain. You know, I was just like, but proprioceptively, her whole body, Wendy, it was like her parasympathetic system. It's almost like you could see her parasympathetic system go, and all her muscles start to relax and elongate, and she just changed her whole, just her whole body shifted, and her eyes and everything. And she just stood with her right toe. She's told us, that's all I need. I just need my right toe and my left foot. Thank you very much.
It's so important to let them show us what they want, because I always say that they know their body better than we ever will.
Yeah, totally.
And it's really about allowing them the opportunity to explore and figure out what's working for them.
Yes. And all the trauma in that foot. And of course, her entire proprioceptive system has been really, you know, hindered, you know, from the foot all the way up. And so, you know, it's like she's trying to redefine what that means, what balance is to her again. And these pads, I mean, I can't wait to be trained in them and work with you so I can learn more and do more. And I know
I'm like really starting to get the itch to get back on. I have to figure out how to do this. I'm doing a test going up to New Hampshire where everything's kind of quiet in the country, and going to do a workshop with people that I know and see how that goes, because you know, I really need to get back out and be training people, because this is such a, and the beauty of it is, with very little information, you can offer the horse, like your webinar has been phenomenal. The amount of the information dump that you have just given us is so amazing in terms of understanding this. And at the same time, all you have to do is offer it to the horse. You don't have to actually understand or know all this information, because horses will show us what they need.
Absolutely.
Yeah. So, you know, like for me, I'm so hungry to, that was the first thing, you know, as a scientist, the first thing I wanted to know is, how is this working? And I've spent now over 8 years trying to answer that question. But, you know, every webinar is another nugget, is another piece of the puzzle. And it's kind of like just putting this jigsaw together to understand how this horse functions and what systems the pads are influencing to create these changes. And you know, and we still don't totally know. One of my favorite things at some point would be to do a brain scan on a horse while they're on a pad.
Yes.
That's really what I want to do. Anybody got a brain scan machine out there?
Yeah, and you know what? That I swear that's coming, because there's been some studies with horses having, you know, brain scans. So I do feel like that's in our future. I really feel like that's
absolutely it is. And I think it's at Stanford they've done a little bit.
Okay.
So, but because I think when we see what's happening in the brain while they're on the pads, we're going to understand a bigger picture of, we know there's all these receptors. We know they're feeding into the central nervous system and into the brain, and there's information coming out, and we see it coming out because we see the change in muscle tone, we see the change in fascia, we see the relaxation, we see the change in movement, we see the coordination. But you know, I mean, the central nervous system is running that show, and so I'm looking that there's neurochemicals released just by the relaxation and the
and different mechanoreceptors, so the horse can find a different comfort in its body that it didn't have before. I know I watch my horses on the pads, and they're just, you know, I've still got some old pads, but they just, their whole body changes. They want them. I mean, it's amazing. It's just phenomenal. So I think this, you know, for retraining from the perspective of proprioception, yes, we don't need any of this information. I think it's good for people to understand some of the reasons why their horses might do certain things and to be educated. But ultimately, we just have to listen to our horses, and they will tell us what they need. And I really feel like these are just revolutionary in supporting horses to regain proprioceptive awareness in their bodies. I really do. And I just thank you for all of your years of work, Wendy, creating this and just constantly seeking new information and educating us, and you know, still seeking for more information. One of these days, we're going to know what's actually happening in these bodies. But until
I feel like I'm sort of the steward of this process. Like the first horse was 15 seconds when he went from lame to sound. And it was like a lightning bolt. It took over my life. It has literally taken over my life, my house, my horses, my everything. But you know, it's to see how many horses are being helped, and see how many people are starting to have a whole new understanding of their horse, recognizing patterns. It acts like a magnifying glass, seeing what's going on, seeing changes, feeling changes. You know, it's part of the paradigm shift of becoming aware of the sentient being that we're sitting on, and that we need to give them a voice so that we can actually form that partnership that we all talk about and want to have.
Absolutely. Absolutely. I couldn't have said it better myself. Absolutely.
Well, Deb, this has been
Oh.
2 hours. It's a marathon webinar.
Sorry, Wendy.
It's been amazing. It's been really awesome, and I want to thank you so much. You know, I knew just from the communication that we had that this was going to be just a really powerful talk. And what I so think is great is that you have tied in so many of the other webinars into a concept to push everything forward. And I just really want to thank you so much for spending the time.
Well, I just thank you for having me, and I just thank everybody for being on this evening, and hopefully we'll all be able to get together in person at some point soon.
Yeah. Yep. All right. So tomorrow we're going to go a little more low key, I think. If you just want to unshare your screen, Deb.
Yeah, certainly.
Yep. Tomorrow I have Bess Miller as my guest, and she is a breeder of ponies. She's been working with her foals with Surefoot pads, and has some amazing stories and experiences working with foals. So when you think about the nervous system and how, you know, if that horse isn't getting the good information they need right from the beginning, this is a way that we can help make sure that they're going to get good proprioceptive input right from the start. And what happens when some horses don't seem to have that in the beginning. So I'm really looking forward to having Bess tomorrow. It's at 1 o'clock Eastern Daylight Time. And just remember, all of these webinars are on the Surefoot Equine YouTube channel. You can go there, just subscribe. You'll get a notice when we put up a new one. I am going to keep going with the webinars until I leave for New Hampshire, and then I may even be able to do some while I'm away. And I'm already booking my guests for when I come back and into August. So stay tuned. Lots more to go. This is like, you know, bachelor buttons in Larkspur. Very good. Excellent. That's what my background is tonight. This is the garden in the front of the house. That's correct. And some of the Larkspur is pink, but most of it's that really deep blue that I like so much. So thank you all for joining me. We'll see you tomorrow or at some other point in time, and have a really good night. And thank you so much, Deb. This has been such
Thank you, Wendy. Good night, everybody. Bye.
Bye.